Welcome to another video, and today we're going to be discussing some renal vascular diseases, okay? And this is part of the clinically high yield series, and where we try and cover the most important relevant points for your clinical practice and for when you see the patients, okay? When it comes to thrombocytopenic purpura and hemolytic uremic syndrome, both these diseases have very similar patient presentations. So, although the differences are subtle, they are necessary. You need to know them in order to be able to diagnose correctly. And so, thrombocytopenic purpura. Something happens to the RBCs, anemia. Something happens to the platelets. What can happen? Thrombocytopenia. Something happens to the renal function. The kidneys are compromised. And then your CNS. You have fluctuating CNS signs. And you also have fever. Now, the thing is, thrombocytopenic purpura affects adults more. Hemolytic uremic syndrome affects kids more. Okay? Now, the treatment for thrombocytopenia purpura is going to be urgent plasma exchange. Okay, urgent plasma exchange. You're going to use steroids and you're going to use plus or minus about the IV vincristine and IV immunoglobulin. Okay, so when it comes to hemolytic uremic syndrome, the treatment is often a spontaneous resolution because HUS, hemolytic uremic syndrome, is caused by a bacterial origin. It's because you have either infection with E. coli or Shigella, and through that eating of food, contaminated food or water, you get HUS. Again, you have anemia. Again, you have thrombocytopenia, which just means you have an abnormally low platelet count. Whenever you have deterioration of the renal function in these diseases, you're going to get proteinuria and hematuria. Now, I've got a lot more on proteinuria in the nephrotic syndrome videos, as well as in the nephritic syndrome videos. So keep your eye out for that.